The Department for Work and Pensions, DWP, is currently facing significant criticism following recent changes to rules and regulations that could lead to thousands of people across the UK losing their free bus passes. These changes are causing concern among disabled people and other vulnerable groups who rely on these passes for their day-to-day mobility and financial savings. The potential impact of the new rules is far-reaching, and many fear that access to free travel, a vital lifeline for many, could be severely restricted. At the heart of the issue is the connection between free bus passes and the Personal Independence Payment, PIP, a benefit designed to help with extra costs for people living with disabilities or long-term health conditions. Until now, those who received the enhanced rate mobility component of PIP were generally eligible for a free bus pass, allowing them to travel easily and affordably. However, recent welfare reform documents from the DWP suggest that losing PIP might not automatically disqualify someone from keeping their bus pass, which has led to confusion and concern. The situation is complicated by the fact that the PIP assessment does not always factor in mobility issues directly, meaning that some individuals who still face mobility challenges could be unfairly impacted by changes in benefit eligibility. In regions such as the northeast of England, disabled persons' travel passes are available to those with an eligible disability expected to last at least 12 months, or for individuals aged 5 or over. The criteria for eligibility include a range of disabilities, such as being registered blind or partially sighted, profoundly deaf, unable to speak, or having difficulty walking or using both arms. It also includes those with learning disabilities or medical conditions that prevent obtaining a UK driving licence. The application process requires proof of disability, which applicants must provide as part of their submission. The guidelines on how to submit this evidence are detailed on the application forms, ensuring transparency but also adding to the bureaucratic process applicants must navigate. In England, free bus passes for disabled people are provided through local councils under the English National Concessionary Travel Scheme. While the passes are often linked to receiving the enhanced mobility component of PIP, this connection means that any changes to PIP rules could directly affect pass eligibility. Importantly, even if individuals do not actually receive payment from the benefit, qualifying for the enhanced rate mobility component ensures eligibility for a bus pass. Other groups also qualify for these passes, including those over the state pension age, carers, and individuals protected under the Armed Forces Compensation Scheme. For disabled individuals, the ability to apply for and retain a free bus pass represents not just a convenience but a significant financial saving, especially as transport costs continue to rise. The potential loss of these passes could restrict the independence of many who rely on public transport for accessing work, education, healthcare, and social activities. This is especially troubling given the government's ongoing welfare reforms and the increasing scrutiny on benefits. In response to growing concern, a public petition advocating for free bus travel to be extended to everyone over 60 in England has recently surpassed 100,000 signatures. This milestone means the petition is now eligible to be debated in the House of Commons. The petition highlights what many view as an unjust situation and calls on the government to ensure equality for all older people outside London, where free bus travel is already available for the over 60s. Currently, eligibility for a discounted or free travel pass in England includes several categories. First, older persons who have reached their 66th birthday, which is the current state pension age, qualify automatically. Secondly, individuals under pensionable age with a learning, speech, visual, or physical disability can apply. Carers who accompany someone unable to travel independently are also eligible. Additionally, members of the Armed Forces Compensation Scheme may qualify. To meet the disability criteria for a free bus pass, applicants usually must have undergone a PIP assessment and provide proof of receiving the enhanced rate mobility component. Alternatively, scoring at least 8 points in the moving around or communicating verbally sections of the PIP assessment can also qualify. Evidence of receiving the higher rate mobility component of the Disability Living Allowance, DLA, a previous benefit similar to PIP, strengthens the application. The scheme defines disabled individuals with specific eligibility criteria, including being chronically sick or disabled with a condition that permanently and seriously impairs the ability to walk. Those who are permanently blind, unable to perform tasks requiring sight, or assessed as having learning disabilities also qualify. Registration as profoundly deaf, with or without speech, or being unable to use both arms due to disability further supports eligibility. People who have had a driving license refused or revoked on medical grounds also fall within the qualifying group. Partial sight loss, when verified by a consultant ophthalmologist, is another accepted criterion. Beyond these criteria, other qualifications include holding a disabled parking badge, receiving the War Pensioners Mobility Supplement, or having an education, health, and care plan, which applies to individuals up to 25 years old. The passes allow free bus travel throughout England, except in London, where a separate scheme operates. For many, this concessionary travel scheme offers an average annual saving of around £500 on transport costs, which is a significant financial benefit, especially for those on fixed incomes or relying on benefits. Losing access to free bus passes could therefore create a considerable burden for affected individuals, compounding existing challenges related to health, mobility, and social inclusion. The potential scrapping of free bus passes due to changes in the PIP rules has sparked widespread concern among advocacy groups and those directly impacted. Many argue that mobility should be the key factor in determining eligibility, not just the receipt of a particular benefit. The fact that PIP assessments do not always fully capture the realities of living with mobility difficulties means the new rules risk excluding those most in need. Councils and disability organisations are urging the government to reconsider these changes and to ensure that no one loses vital access to transport simply because of altered benefit criteria. The free bus pass is more than just a convenience for many disabled and older people. It is a means of maintaining independence, accessing essential services, and participating fully in community life. The debate continues as the government responds to mounting pressure. The public petition pushing for free bus travel for all over 60s outside London is gaining traction, reflecting a wider desire for fairness and inclusivity in public transport policies. Extending free bus travel to more groups could reduce social isolation, encourage healthier lifestyles through increased mobility, and ease financial pressures on vulnerable populations. This issue highlights the complex interplay between welfare policy, disability rights, and public transport accessibility in the UK. It underscores the importance of clear, fair, and compassionate rules that acknowledge the diverse needs of disabled people and older adults. The ongoing scrutiny of the DWP's rule changes will likely shape future debates about the role of public benefits and transport concessions in supporting a more inclusive society. In summary, while changes to PIP eligibility rules threaten the free bus passes many rely on, the public response shows a strong desire to protect and expand access to free travel. Disabled individuals, older adults, carers, and advocacy groups are united in calling for fair treatment and continued support through accessible transport options. With continued pressure and political engagement, there remains hope that these crucial concessions will not only be preserved but enhanced for the benefit of all who need them.